Environ Life Science Limited, partnering for life.
Hello everybody, my name is Dr. Nandita Rai and I'm a cosmetic dermatologist, private practitioner in Siliguri Near Skin Clinic. Today I'm going to talk about hair fall problems and also skin problems during monsoon season. It is a great problem right now, not only in India but internationally whenever it comes to hair and skin conditions. But during monsoon season, during rainfall season, when the climate is really not great, it's very humid and very hot and very harsh. Sometimes it rains terribly, sometimes the humidity rises because monsoon in India, because of our tropical climate areas, we get a lot of patients with skin and hair problem in this time of the month, especially the flare up of eczema, dermatitis, fungal infections, hair fall, acne eruptions, psoriasis, skin irritations, all actually come along in this weather or monsoon in India. And it has been experienced not only in north or northeast or south, every part of India, because humidity rises and there's rainfall, there's again sunlight, again humidity. So all this extreme climate change is also taking place, and due to overgrowth of population and pollution, climate changes are taking place, due to which we actually get a lot of sulfur, nitrogen oxide, carbon dioxide, other toxic gaseous environmental pollutants, and through air, water, and also through food. So this all has created a lot of issues with our skin health and hair health, and also definitely directly or indirectly it's leading towards our overall health. And this is basically also due to our lifestyle and dietary imbalances which we are going through in this modern world. Lifestyle is not great, we sleep late, we eat here and there, we don't have timings, and also the diet products which we get in the market is not so much up to the mark and up to the date. It's not really great nutrition. So because of all that, we face a lot of overall health, and definitely ultimately it comes to skin and hair, which is the mirror of the body. So skin and hair is the mirror of the body because it shows how great you're doing in your health or how nicely you stay in your life, whether your lifestyle is great, whether you're investing in yourself. So it all shows up with the skin and hair health, whether you're exercising or not, because exercise also leads to good improvement of health due to circulation, due to muscle movement, metabolism. So it definitely shows that what is your lifestyle, what is your overall health, and this speaks ultimately about your mental health too, because physical health reigns over mental health too. So it definitely affects indirectly, directly, somatopsychologically, by skin condition, hair condition, or any other concomitant diseases, for example, diabetes or kidney problem or liver disease. What I can say is this is the introduction part, and the main problem that I'm coming across here is people during monsoon comes with hair fall problem a lot. They say that even if I wash hair daily, it's falling off, and even if I don't wash, it's really getting clogged and dandruff, and hair is getting sensitive, brittle, and it's falling off, and I'm going into alopecia. So there's definitely a condition called alopecia, and alopecia is of different types, like alopecia areata, universalis, there is ophasis, there is band-like pattern hair loss, telogen effluvium, trichotillomania. So which of course is a psychiatric problem where you have obsessive compulsive disorders, personality disorders, and you try to pull your hair constantly, instantly, even if you don't feel like, you like to pull your hair in stress or any other reason, and then you even eat it up. So these are the hair loss problems that we see in our daily clinics, and patients are really frustrated physically and also mentally. And what we actually try to do is diagnose the great problem. What is the reason behind the hair fall problem? Number one problem is, of course, our daily lifestyle, where we lack exercise, where we lack proper diet, nutrition. And another thing is sleep. We don't sleep at all nowadays because of the electronic gadgets that we use for our daily life, work, and also study and career fields. So these are all leading to destruction of our daily lifestyle. Another factor is pollution and population, which is really increasing it at its own pace rapidly in India, and we need to focus on that also, due to which climate is changing also in India, not only in India but all over the world. And pollutants, toxic materials are really there everywhere because we are inventing new things. We're doing a lot of scientific advancement. Because of that, a lot of other great things are happening, as well as toxic pollutants are there in the environment. So this is another factor. Third and fourth factor is your diseases that ultimately comes from this environmental and mental health and physical health problems, that is diabetes, hypertension, hypothyroidism, weight loss, weight gain, mental health problems, and also your daily lifestyle, like how you use your hair products. Like, do you shop online a lot, or you use here and there all the hair care products? You don't actually really care that you should not iron or straighten your hair daily. So you're straightening the hair daily is very bad for health. Blow drying up your hair daily is also bad. Coloring. So these all are the things which leads to hair loss problems. And also genetic is another important factor. So if your whole family don't have proper hair growth, or it is like that history is they lose hair at certain point of time, then definitely you are also one of the target person. You might lose hair. And other diseases, like I said, like thyroid problems, Hashimoto, you can get totally, alopecia universalis and totalis. So in this condition, we need to really go through the history, condition, and then go to what we can do as prevention. Even we refer to medical specialist, and if it's hormonal like PCOS, polycystic ovarian syndrome in women, we refer to gynecologist or endocrinologist to check the hormonal levels and cycles that may be irregular. And along with that, acne problems also come. So we again go hand to hand with the medical specialist, gynecologist, and endocrinologist. We diagnose it by clinical symptoms. Of course, we see that when we do full test, it's positive. When we check with our dermoscope and hair analyzer, it's really there. The scalp health is not great. It's oily, clogged, dandruff, and also it can be brittle, or maybe there might be not any hair left. So these are the diagnostic tools and methods which we use for in-clinic diagnosis. And also we can go for biopsy, because lichen planus fibrosis is also there in, lichen fibrotic alopecia is also there, where you have lichen, fibrosis of the hair, and you have to treat the disease, systemic diseases, autoimmune diseases are there. So you need to treat that also by referring to either a medical specialist, or evaluating and giving them some immunomodulators and suppressants, and also solutions like minoxidil, finasteride, which works wonders in the hair growth factors. And we prescribe medications with certain duration of time, maybe 3 months, 6 months, 8 months, 1 year, and follow up the patient regular basis. We do blood tests, of course, with vitamin B12, D3, DHEAS, hormonal problems, thyroid, sugar, liver, kidney disease. So we all evaluate that, and then we give prescriptional drugs with minoxidil, Capixil, Redensil, and supplements like amino acid, biotin, or maybe a great healthy food is enough, and exercise and all lifestyle maintenance. After that, if patient chooses a cosmetic or alternative treatment, if there is platelet-rich plasma, platelet low plasma, and fibrin that we use in the clinic. After deriving the whole blood from the patient, we make plasma out of it, and then we inject it, because it consists of a lot of growth factors, great for hair. Even after hair transplantation, restoration, surgeries, you can use PRP, platelet-rich plasma injections, as alternative cosmetic treatment, which is great for hair growth and support of volume loss. And also I can see that it brings back the natural hair color. Along with that, there are laser lights that you can use on hair, and microneedling, derma rollers with cocktails like amino acids, catepsil, retinol, and there are other hair serums that comes, along with it, which consists of biotin, finasteride. A lot of other cocktails are there in the market. So we use them in form of mesotherapy with dermapen or micro, needles, or you can say derma rollers. So these are the alternatives. I think, if you catch your symptoms early and come to visit dermatologist as soon as possible, you see that your hair is, you're risking a hair loss problem, and your family is also having that problem, then you must visit dermatologist as soon as possible and get the acquired treatment. We have not only the medical treatment but also cosmetic treatment, and it has shown great results, especially in the clinic. In my clinic, PRP has shown great and best results.